Hi guys, I'm Dr. Hardik Ganatra. I'm a plastic surgeon based in Dubai, and I'm your host to Health, Beauty, and Fitness. And today we have the beautiful Pravadha Menon at our show. She's a video jockey. She's a TV anchor in multiple channels in India. She's a social media consultant and a marketing consultant and an influencer as well. So over to you, Pravadha.
Thank you, Dr. Hardik. And that was really sweet of you. That was a good intro. And since he said certain good things about me, it's now my turn to talk about Dr. Hardik. As you all know, as he himself said, he is a board certified plastic surgeon hailing from India with a wealth of experience in both surgical and non surgical solutions. After getting his medical education and rigorous training in India, he further honed his skills under the guidance of veterans in plastic surgery, both domestically and internationally. So, correct me, doctor, if I'm wrong, but specializing in body contouring,
Sure.
his expertise encompasses various techniques like advanced techniques like is it Vaser or laser?
It's laser, Vaser, Renuvion or J plasma liposuctions.
Yeah, that's what Vaser, Renuvion, liposuctions, abdominoplasty, body lifts, Brazilian butt lifts, and so on. So, and I would say renowned in his mastery in liposculpturing.
Thank you.
He is actually very famous across various countries for his like signature surgeries procedures like the Spartan body and the Wonder Woman procedure. Am I right?
Yeah, so that's the bikini body transformation that we do where we not just remove the fat, but we sculpture the body. So we define their ab muscles, we define the area above the buttocks, you know.
Okay.
So we give a nice back to butt transition. We add volume in areas like the breasts and the butts to create that, Brazilian or a Colombian
Wow.
bikini body.
Wow. So that's liposculpturing, right?
That's a liposculpturing. So
Yeah.
it's a liposuction which is removing and sculpturing which is revealing. So it's a
Okay.
remove plus reveal. Because
Okay.
back in the day, liposuction was a fat person going in the clinic and coming out as a slim person
Right.
or a leaner person.
Right.
Now we've got even slimmer patients coming to us and getting much more defined and getting out.
Wow. And one thing I have to talk about, Dr. Hardik, is that, him being a very passionate promoter of confidence and healthy living, he just not only transforms his patients' physical appearance, but also motivate and encourages towards self-improvement. And
Absolutely.
I think that comes also from the fact that him being a very much of a fitness enthusiast himself, a seasoned bodybuilder, and as you can see, and ISSA certified coach. Am I
Yes.
right? So, being that, I think he's a beautiful amalgamation of surgical artistry and fitness solutions put together, right?
Thank
Doctor,
you.
how do you seamlessly integrate, as I said, this kind of surgical solutions and fitness solutions together?
So that's a good question, and I would say I started bodybuilding about 23 years back. So I've been
Gosh.
training in the gym for a long time.
Okay.
And then subsequently, I got into medical school. I became a general surgeon for 3 years and then plastic surgeon for another 3 years of residency. All in all, I studied about 12 years after high school.
Okay.
But during the entire journey of medical education as well, I've been training in the gym to reach wherever I am. Now, this experience in bodybuilding encouraged me to pursue a niche practice in cosmetic surgery, which is called body contouring. So, the study of anatomy and all of that we did, physiology, anatomy, in medical science also helped me in bodybuilding. So, it was like a dual combination. Medical education helped me with bodybuilding, and bodybuilding helped me with bodybuilding helped me
Yeah.
with my surgical
Surgery.
skills. Yes.
So that's a deadly combo, isn't it? And I must say that it's not just surgical solutions, but also doctor, you are a you are the go-to person in the Middle East for non-surgical cosmetic treatments as well, like Botox, fillers, anti-aging treatments, and
True.
so on. So I would say that he's one of the most sought-after plastic surgeon in the Middle East.
Oh,
I
thank
mean,
you.
in your past tenure, I mean, how long you've been in the Middle East? Tell us that.
So I've been in the Middle East for about 8 years now. Before that, I was practicing in India for about a year and a half. So I've had a small share of practice in India as well,
Okay.
but my majority of practice for aesthetic surgery has been in the Middle East.
Okay, so being in the Middle East, and as you said, you had a short stint back then in India as well. So, being in the Middle East and in India, what do you find are the differences in the pattern of surgeries and non-surgical solutions back in India, which is very common here versus back in India? I mean, what is the difference like?
There is actually a stark difference. There is a lot of taboo still prevalent in India about cosmetic surgeries. People are against cosmetic treatments like Botox fillers. They think it makes you look fake.
Oh,
So whenever you
yeah,
Google,
the taboo.
yeah, it's a taboo. So whenever you Google Botox or fillers, you see botched complications.
Right.
But this is what I explain to people when I visit. Now I go to India as a visiting surgeon. This is what I explain to them, that if you go on the road, then you will always see one or the other accidents on the road. But that doesn't mean you stop driving.
True.
But don't you see how we've evolved from walking in the sand to now using roads, skyscrapers, and eventually, Dubai is planning to get air taxis.
Right.
So do we stop flying in the air just because it's risky?
That's true.
So every procedure, every complication will have a small amount of risk that it carries. Getting up from the bed, walking on the streets, everything has a small risk. But
Yeah,
imagine the gratification that we get from it. So
that's right.
I get Botox done regularly, about 7 to 8, every 7 to 8 months, and that helps me look younger and fresher. And why not? These practices have developed for us to look and feel better about ourselves. It infuses so much of confidence in ourselves. So I do not really understand the hesitation for that. I understand that there is a lot of obsessiveness that comes with these practices in India as well as abroad. Also in India, financially, India is still growing.
Hmm.
So compared to the Middle East, where Middle East attracts a lot of wealth and wealthy people,
True.
so they can very well afford these practices because this is luxury.
Right.
What we deal with is luxury because this is not the need. A cut finger, a a ruptured appendix, or a hernia, or a brain tumor is the need of the hour. You have to get it done regardless of whether you have money or not.
So, since you said about the cut finger and all that, people still don't identify the difference between cosmetic surgeries and reconstructive surgeries. People just think plastic surgery is all about luxury, but sometimes there are reconstructive surgeries as well, which is like kind of mandatory, something
Uh,
which we need to do
true,
it on
true, true.
time.
It is so funny now that you're talking about the differences between India and Middle East, especially Dubai.
Yeah.
In India, plastic surgery is equated to burns and reconstruction mainly. So
Oh,
people don't even know. Some people, when you talk in rural India, if you talk to them about plastic surgery, they think it deals with plastic, like
okay.
literally the material plastic.
All right.
While in the Middle East, because it's so fancy, the wealthy people around, it's so famous for, like Beverly Hills, for plastic surgery. When you talk to people in here about plastic surgery, it means only beauty surgeries. So that's the reason why people need education. People need information on what plastic surgery actually encompasses. Plastic surgery encompasses reconstructive surgery, which is after trauma, let's say after accidents, when someone has an open injury.
Yeah.
Orthopedician probably would come and fix the bone, but what if the bone is exposed because there is no tissue over it?
Right.
So that is trauma reconstruction done by plastic surgeons. Reconstruction is also done after burns.
Okay.
This is a plastic surgeon's forte. It's not supposed to be done by general surgeons or other surgeons.
Right.
Plastic surgeons specialize in this. We used to hold up a burns unit encompassing about 100 patients.
Okay, so see, this is what Dr. Hardik is all about. And I have to tell you this because, we met. I don't know how many years back.
It's been about 7 years since I
Seven
came to
years,
Dubai.
yeah.
Yes.
We met during an event, and ever since then, and we just gradually struck up a conversation. And ever since that, it's been like we just became so close friends and started talking about everything under the sun, from beauty norms, aesthetic surgeries, fitness, yoga, and trust me, diets, and everything under the sun. We started talking, and then from now on, it's been a journey where he's the go-to person for me in terms of any questions or concern regarding skin care, hair care, or fitness in general. And what I love about Dr. Hardik is that more than being, he is a very skilled and expert doctor, as we all know, but more than that, I would say he's a compassionate individual and a very supportive friend. So here, and what he keeps asking me is about how is the film industry, what is the beauty norms there, and things like
Yeah,
that.
that's something I'm always curious about, because that's your forte, and so
Yeah.
it's always very exciting for us to know how the media industry functions, because we only get the consumers or the customers from that coming to us. But I want
Right.
to know why they do these things. Is there a lot of pressure in
Yeah,
the media industry?
absolutely. In the film industry, staying on top of the trending beauty treatments is kind of crucial, to maintain a competitive edge, and to for meeting the high standards of on-screen appearance. I would say the demand for perfection is extends beyond talent these days,
Sure.
and I mean, with the coming of high resolution cameras, and and the kind of competition going beyond performances. It's being their looks are being judged. The flawless looks are always mandatory. I mean, wherever you go with the coming of airport looks, gym looks, and everything, wherever stars, celebrities go, the camera is around. So they
Yeah, you
have to
can't
look good.
escape that. Yeah.
Yeah, they have to look good always. So the kind of pressure to look flawless is relentless. So I would say, and also when coming to their professions, the fear of being overlooked for certain roles, or being replaced, or losing an opportunity to somebody who fits the conventional standards of beauty. So these kind of things do does exist,
Yeah,
in the film
sure.
industry. It's very much unavoidable because it's a very fiercely competitive world. It's a cutthroat world of entertainment, and everybody has to put their best foot forward, in terms of looks, in terms of talent. I mean, definitely talent and skill is something which is really valued for, but at the same time, flawless looks are also, very sadly I would say, is definitely being judged and scrutinized as much as the performances.
Sure, sure.
So that's very important. The pressure is really high.
Yeah, sure. And what about the South Indian actresses and actors? I mean, I'm sure you would have heard of a lot of them getting
Yeah.
surgeries. Could you give us some
I
interesting
I
examples?
think I have told you once. I have asked you once about this actress, Shruti Hassan.
She's Kamala Hassan's daughter, I
Yes,
believe.
Kamal
Yeah.
Hassan's daughter. I've asked you about her. Doctor, is she done, has something, nose job, rhinoplasty, or something like that? Because these days, people can make out immediately the changes that the person, I mean,
Yeah,
her nose is different.
yeah, but while the world goes gaga about her getting a nose job done to look beautiful, I would also say that she would have so much of pressure because she's Kamala Hassan's daughter.
I
So
swear.
Kamala Hassan probably might want her to be a film actress, and
Yeah.
she wants to be that as well.
Yeah.
But then her nose would put her down because she knows she's got a bigger nose with a big hump. Also, a big nose, her tip was pointing down,
Right.
and if the tip points down, the distance between the nose tip and the lips is very short. So the
Oh.
lips also look smaller in that aspect. So for
Oh.
all of these reasons, I'm sure there was a tremendous pressure on her to look good, and that's the reason why she opted for a rhinoplasty. And she looks beautiful after rhinoplasty, so I would say why not? And this is not me trying to sell a rhinoplasty. I don't even perform rhinoplasties as a body contouring exclusive surgeon. But my point is, why are we so quick to judge
Yeah.
And and shame people, not just judge, but shame people on getting surgeries. Like Bhumi Pednekar is a massive weight loss patient.
She
She
has done
was,
undergone tummy tuck,
she's, I think she would
if
have
I'm not
undergone a
mistaken.
bariatric procedure or some form of procedure to lose a lot of weight. And after, what happens after you lose weight, you
Right.
get a lot of loose skin. So then she probably underwent a tummy tuck, because you can see from her belly button that it's been created. It doesn't look as natural as it should be after a tummy tuck. So it does, it's obvious that she had a tummy tuck procedure done.
But what I would like to ask you about, earlier days, people were like, even Devi, the queen of so-called Bollywood, she has done a nose job from south to north when she was getting more roles in the north. So she had to change her nose, the shape of the nose, more sharper. So the result is visible for everybody, and the outcome also is visible for everybody. She became so massively popular in the north.
Sure.
I mean, after her nose, it's very obvious.
Yeah, but
So,
these procedures were created to give you more confidence, to make
right.
you feel more beautiful. And my question is to the audience, my question is to the people, the audience, not just of this podcast, but of the entire world. When you look at a particular celebrity and you appreciate them for their looks, for their nose, for their face, as soon as you realize they've had a nose job, why do they now become the victims and culprits? Because is it because they did something wrong? If they have the means to get a surgery done,
Right.
and they got it done, and that helps to make them feel more beautiful and more confident, why not? I would say this shaming of plastic surgery, like, oh, this person got a nose job, oh, this person got a liposuction, came in because of people who actually cannot either afford, sorry to say,
Right, right.
or who are against it, for just because they are stuck up with their stubborn beliefs that
Yeah.
a nose job makes you look fake. It doesn't make someone look fake
Yeah,
if it's
but
done by the right person. Like, look at Shruti Hassan.
that's the
Doesn't
point.
she look beautiful? Look at Kylie Jenner.
But what
Look
you
at Kim
said,
Kardashian.
doctor, right now is the most relevant point when done under the right person. So that is another point which I want to address here, because mostly we are talking about the plastic surgeries gone right here, but we are dealing with so many cases where we see plastic surgeries gone wrong, totally wrong. So
Absolutely.
that is where people start raising fingers regarding, why go under the knife if this is what you get after spending so much of money to a plastic surgeon and getting what this is, a result like this. And I mean, there are so many board certified plastic surgeons here, and with surgeons with good credentials as well. But there are so many people in this market. And here, what I would like to ask you is that, where do we go to? Because I've heard Brazilian butt lifts, which you're doing
Yeah,
so
yeah, yeah.
many these days. It's kind of banned in the UK and so many places because of the dangerous outcomes. So tell me, doctor, whom do we go to? Whom do we trust?
That's an interesting question. So I'd like to first answer the question on Brazilian butt lift. So
Yeah.
the rates of the incidence of deaths after a Brazilian butt lift used to be 1 in 2,500, which is massive. Like 1 in every 2,500 person was dying, and they were dying because the fat was being injected in the muscle or under the muscle. So in the butts, you have the skin,
Okay.
you have the fat, the
Okay.
fat pad where we sit on.
Right.
Then you have the muscle layer, and then you have the bone, the hip bone.
Okay.
Now, what happened was surgeons started injecting. They did not know which plane to inject, which layer to inject in. So some of them started injecting randomly in the fatty layer, or even in the fatty layer is great, but they started injecting in the muscle or under the muscle to give like a massive butt appearance. Now the problem is there are major blood vessels which are running under the muscle. So this fat would go into the veins, would cause clotting in the lungs, which is called pulmonary embolism, and this would lead to people dying. Now, this can happen if a surgeon does not, if a person goes to an unqualified person.
Yeah.
So, if you go to a non-board certified surgeon, a general surgeon is not qualified to do a cosmetic procedure. I used to be a general surgeon. Once I used to do a lot of appendectomies and hernia surgeries, but I have no longer been doing that for 10 years. So would you want to come to me for hernia surgeries? Yes, I've been a general surgeon, but would you still want to? And I am qualified to do that. I would still not do it, not because I'm not qualified. I am qualified, but I am not experienced enough. So qualification alone does not matter. Someone could go to a cheaper or a less experienced plastic surgeon and get a procedure done and still get messed up, which is why studying or researching your doctor is extremely crucial. Number one, go to a board certified qualified plastic surgeon. Number two, make sure that surgeon has plenty of experience. Now, I know that a youngster might not have, someone 1 year or 2 years down the line might not have a lot of experience, but you could go into his credential as to where has he got trained. Now, I got trained pan India, all around India and all around the world before I embarked on my journey to start cosmetic surgeries. When I started cosmetic surgeries, also I ensured that I would only pick up cases which are suiting my caliber. I was not operating on cases which were botched by other people. I was not operating on complicated cases because I knew with all my humble conscience that I was not fit to do these surgeries. Now, every surgeon unfortunately doesn't think that. I'm not here to try and show I'm super ethical, but I do believe that some level of ethics and conscience is extremely important. A surgeon needs to know what he can and what he cannot do. I still get patients, body contouring, massive body lift patients who've been complicated or have had bad surgeries from other surgeons. They come to me. If I cannot correct them, I happily refer them to surgeons who are much more senior than me. Not because I'm not qualified, number one. Not because I'm not experienced, number two. It's just because I feel someone could do a better job than me.
Okay. Yeah,
So
I
some level of,
understand.
I think, ethics and conscience are very important, right? I'm sure it's with every field, but I think if I would believe this, I inculcate this to my fellows and junior surgeons that I interact with, I think we would want to create a positive chain of people, having
Right.
strong ethics.
Having said that, you said you've been saying no to patients. As an ethical practice, do you have you said no to a patient where the patient has approached you with unrealistic, expectation of beauty or anything like that? Have you said
Sure.
no?
Yeah, that's a very interesting question, and I'll give you a very interesting example.
Okay.
So there was a 14-year-old girl who had come with her mother and sister.
Okay.
She came to me because she wanted to correct her nose because she had a nose similar to Shruti Hassan. She had a hump, a taller nose with a big hump,
Okay.
and a small, and a pointy and a nose tip which was pointing down.
Mm. Okay.
There was a visible deformity. I wouldn't say she had the prettiest nose. This is me being very, me being very honest here.
Right. Right.
So she asked me, doctor, there is something wrong with my nose. I hate my nose. I said, why do you use the word hate? Because I personally believe hate is a very strong word, and we
True.
don't want to live with hatred for somebody or something.
True.
So I said, why do you hate it? Their mother interrupts and starts talking to me. The doc, she's crazy. She wants her nose job done at this age. She's only 14. I don't understand why she has to do all of this just because she said, I will stop eating if you don't take me to a plastic surgeon because
Gosh.
he will understand me. I want to go to a plastic surgeon. So I'm coming here only from sheer, because of the sheer pressure from her side.
Okay.
I said, please, let's do one thing.
Okay.
Either you could go out of the room or you could stay here, but don't just let me and the kid, let's leave me and the 14-year-old daughter, let me and this girl talk
Yeah.
because I want to know from her.
Yeah.
There has to be a reason. I don't think she's crazy.
Right.
So
Don't interrupt
I want to
unnecessarily.
speak to her. So I actually interrupted the mother who was interrupting our conversation.
True.
So now the girl came up with the fact that she was being bullied by her friends because she had a big nose, she had a hump on her nose, and she had a pointed or a or a drooping down tip.
Yeah. 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 Right.
I rejected this patient, but in a way where I encouraged the girl to to focus on the values, on the core values she has. Her nose doesn't make her ugly or beautiful. It's her soul. It's actually what lies inside. That's why they say beauty is skin deep, and they're not wrong. And I know this sounds paradoxical coming or ironical coming from a plastic surgeon, that I say that beauty is skin deep, but it is, Yes, a well contoured nose, a slimmer nose would make you happier or more beautiful. But that young girl, 14-year-old girl, should not be attributing her beauty or her self worth to her nose.
Right.
And this affects people because today, if at 14, at 14, I can't legally operate her.
Right.
I can do it if there was a dangerous condition with her mother's consent. But this is not dangerous. This is for beauty. So legally, I cannot operate. And B, even if I would operate her, imagine. Don't you think that once she gets a more beautiful nose, a slimmer, slender nose, don't you think that she'd start getting so full of herself now that her nose is looking pretty, that she would start to now think next about a lip job, then her breast augmentation, because this is how the society is. The society is constructed to criticize, to pull you down rather than to lift you up, which is sad. But that's how the society is. Today you treat your nose because the society was cribbing or ranting or mocking you about your nose. Tomorrow they might talk to you about your breasts. Heavier breasts, you face the problems of you trying to show off your big breasts. Smaller breasts, they call you a flat-chested lady. Like, society has something or the other to say, Society never stops. But does that really make you question your self-worth? That is my question.
Being a social media influencer myself, I always try to promote this kind of thoughts in people, where I believe, doctor, as you said, there is no harm in going and correcting any kind of body part wherever you feel it's improper, or where you feel a bit insecure about yourself, and what can lead to a life transformation and things like that. There is no harm in doing those things, but as much as you do these kind of things, you need to also understand that true beauty transcends outward appearances. And
absolutely.
it has to be rooted in confidence, self-expression, and authenticity. And also, I would like to add here is that, here these kind of beauty, like more of these kind of inclusive beauty practices will happen only when you embrace diversity, and when you celebrate individuality. So these kind of things you should always keep in mind when you do certain procedures. This is not what defines you.
Absolutely. I mean, look at Tiger Shroff's nose. He's got a big nose with a hump on his nose.
Right.
If the same Tiger Shroff was not Tiger Shroff, let's say you find him in, let's say that you found him in Dubai Mall 10 years back when he was a young kid, would you be so fascinated by him?
Right.
Yeah, probably not. And you'd probably even say, oh, look at his nose. The society would be, look at his nose. He's got such a big nose. This guy doesn't look, he's so skinny.
Yeah.
And now the same guy rose to fame because he dances so well, because he acts so well. He's Tiger Shroff. So now everyone looks at him as if he's the youth icon.
Yeah, you should be
So
happy
the society
with
has this duality where if you are famous, looks are ignored.
Yeah. But yeah, true. But to a certain point, that is also not true. People are not, even if you do very well in your respective careers, and people just keep scrutinizing you for your looks here and there, which will happen, and just have to just go with it. I mean, whatever you can do with, feel good. Here and there, definitely you need to do. I don't say that doing a plastic surgery, doing something, a corrective thing is bad, because that's definitely needed if it imparts your confidence. But that's not the only way to gain confidence.
Yeah, I mean, that's why I say
And satisfaction.
that a beauty surgery will make you happier, not happy.
Exactly.
You create happiness by yourself.
True.
You could be the most beautiful lady in this planet, and you could still be miserable sitting home and crying and taking antidepressants.
You should be happy in your own skin. That's what I do believe, doctor. And having said that, now, since I have you here with me, I spoke to a couple of my friends who are into all this. I mean, everybody is into looking good these days.
And everyone wants to look good. That's the reason I said I do so many treatments myself, because I want to look Very good. Not just good. I want to look absolutely stunning.
Right.
And why not?
And also, I mean, I would like, this is something that I would want to ask you. This is not just my question. My friend who is having migraines back to back, she was told that, she can undergo do Botox for her migraines. And she had read somewhere that it's a good antidepressant as well, treatment as well. I mean, I was shocked because we all know Botox is for fine lines, wrinkles, and all these kind of things.
Sure.
So how come Botox treats migraines?
That's an interesting question. So during a migraine attack,
Yeah.
the blood vessels in certain areas, let's say around the temple, around this area of the
Right.
forehead, the
Right.
blood vessels constrict. Because of this, the muscles tend to get very stiff.
Oh,
Because of the stiff muscles, there is a lot of pain
okay.
in these areas. So someone could have pain in the trapezius or the upper neck muscle. Someone could have pain in the back of the head or the front of the head during a migraine attack.
Okay.
This is because of the spastic or the stiff muscles. Botox actually helps in softening or relaxing the muscles. What we do for these wrinkles also is to relax the muscles. So what we do the same thing for areas where the person is affected from migraine.
Oh, interesting.
So I've had patients who get this done for both. They've it's like do tir se,
Yeah, ek tir se do.
ek tir se do nishana, or
Yeah.
one, two birds with one
True,
stone.
true.
So they get rid of the wrinkles, let's say for this area, and simultaneously the frequency of migraine, the intensity, I would say, of migraine attack reduces. So the next time they get a migraine attack, it doesn't affect them so much. The dosage of the medicines they need to take, the frequency of the medicines reduces, which is very good, because at the end of the day, these medications that you take for migraine are chemicals, right?
Right.
And you can't rely on these medications all throughout your life. Let's say you are in a meeting and suddenly you get a sharp migraine attack, and there are flashy lights around, and you just want to run away from the meeting and you can't. Even if you pop in a pill, the pill takes a little time to
Yeah,
act.
true.
Act.
True, true. I've seen her going through this migraine attack. So that's when.
And it's terrible. They look
Yeah.
like they want to come. They want to kill themselves.
I know. I know.
So, yeah, Botox has diverse uses. Botox is used for gummy smile. So, a lot of times when people smile,
Really?
you can actually see their gums. There is a lot of teeth show and even gum show,
Oh.
especially of course, in
Okay.
the upper lip.
Okay, okay.
So what we do is we inject Botox in around the nose. There is an area, there is a muscle where we inject Botox, which relaxes this muscle so that the upper lip doesn't move so much up when you smile.
Gosh.
And because it doesn't move so much, the gums don't happen to show. This is for people in whom there is a excessive gum show or gummy smile.
Right. Wow, that's a really good piece of info, because we all know that Botox is something for wrinkles and fine lines and all that. But this kind of really.
So there are medical indications
important-
as well, like migraine. There is another indication called bruxism. Bruxism is teeth grinding. So you might have known of friends who are using night guards.
Yeah, 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 yeah.
And because they tend to clench their teeth a lot, and Botox. So bruxism, of course, the cause of bruxism could be a temporomandibular joint, or the joint over here, the bony joint.
Oh.
There could be a problem there. There could be a problem with the teeth, which needs to be addressed by the relevant specialist.
Right.
I'm not specialized in that.
Right.
But an effect, not the cause, but an effect of teeth grinding is that people who grind their teeth so much, they have pain in their muscle, because this muscle gets overactive when they grind their teeth. It's like if I keep flexing my elbows for some reason, I have pain in my biceps, because when I flex, my biceps get involved. Same way, this muscle gets stiffer and thicker because of constant grinding of teeth. So, and people have pain in the jaw.
True.
So we can actually inject Botox in this muscle, which is called masseter, to relax this muscle so that they no longer have jaw pain, which happens in bruxism.
Oh, that's cool. So we spoke about Botox and its other uses as well. So here I want to add one more thing about PRP treatments. We know platelet-rich
plasma. Yeah.
So now exosomes. I'm hearing a lot
Oh,
about it.
I'm glad you know about exosomes.
Yeah,
Yeah,
because-
exosomes are coming up big time in the market.
So that is now trending these days. So what is it? Is it same as PRP, or what is the difference?
So exosomes have much more growth factors than PRP has. So imagine exosomes are small bubbles that contain DNA, RNA, peptides, and growth factors. So this has relevant to a particular area. For example, if I want to use exosomes for the scalp, for hair growth, there are specific exosomes for that. If I want to use exosomes for producing collagen for the skin, there are specific exosomes. So exosomes are exosomes are more specific.
Right.
B, exosomes have lot more growth factors than PRP has. C, exosomes don't need a blood extraction like PRP does. You know, for PRP, you
Yeah.
need to take blood,
Yeah.
run it in a machine centrifuge, get
Right.
this yellow liquid, which is PRP, and then
Right.
inject it.
Right.
Takes a lot more time as well.
Right.
But remember, both of them at the end of the day are biostimulators, which means something which is naturally a part of your body, which is being re-injected
Right.
to produce some natural substances. For the hair, it is to produce growth factors to grow hair. For the face, it is more for collagen. I've gotten an exosome treatment done myself. Oh
Really?
yes, I have. So
Okay.
this was micro needling with exosomes for acne scars, because as I was growing old, I used to pop my pimples, which is, guys, which is
You're
not
growing
supposed to be done.
old. Seriously. Okay.
Yeah,
Okay. Okay.
yeah, I'm growing old. Come on,
Yeah,
don't
it
be so
doesn't look
kind.
like.
So as I was growing old, I could see a lot of pimples which I used to pop, and they led to a lot of acne scars. For these acne scars, of course, it would have been amazing if I would have treated them when I was young, or let's say in my teens. But of course, I only knew so much back then.
Right.
Now that I know better, I've started treating them with microneedling and exosomes, which helps in producing collagen and which helps in resurfacing my skin.
That's kind of very specific, more specific than PRP.
Yes, it's definitely more specific, and it also, PRP can cause a little more inflammation. Exosomes are actually anti-inflammatory. Exosomes are also used in cancer and for a lot of other purposes, but that's a conversation for another
Right,
time.
that's a different thing. And before we wind up, I just want to ask you about this. This is something very personal, and
Sure.
people like me would like to know. Doctor, please advise us, I mean, people like me and so many other people out there, about some sustainable beauty treatments. Like if we want to look good, fresh, and, like always looking good and fresh every time. What are the kinds of beauty treatments that we can go to?
So, for all my patients that come to me, I do spare some amount of time trying to educate them on sustainable beauty practices.
Yeah.
It begins first with good food and hydration. I myself am not hydrating myself enough, so I can say that one needs to consume at least 2 to 3 liters of fluids per day.
Very important, yeah.
Having antioxidants coming from vegetables is extreme, and fibers is very, very important. So diet and hydration is extremely important. Besides this, sun protection is very, very important. I tend to forget, so what I do is I have one in the house and one in my car, which I happen to, as soon as I get out of the car, I tend to apply it. As soon as I get back in the car, I tend to replenish it again.
Right.
So that's something I would recommend. Retinol at night. Retinol causes a mild grade of inflammation. Which helps in producing collagen. So retinol is a proven anti-aging cream or an ointment. So that is something that is not even to be debated. I use retinol every night. People should start alternate night, and then slowly they begin with every night. Retinol 1%. So that's amazing.
Right.
Besides this, I go in for Botox every 7 to 8 months for myself. This is not something I would advise younger people. They might probably need it, but I go for that.
All right.
And besides Botox, I would also recommend skin treatments, skin resurfacing treatments like microneedling, which helps in producing collagen. This could either be done with PRP or exosomes. Exosomes are a little more expensive than PRP.
True.
I also recommend chemical peels off and on for refreshing your skin, especially, the AHA, BHA peels, which help in glowing of the skin, especially before the events.
Okay.
So these are the treatments which my go-to treatments to look
looking
beautiful
young
and
and fresh.
fresher all throughout the year.
See, that's all. So now I mean, I think I've covered almost, most of it. Not all. It's a big topic altogether. But mainly whatever is needed for day-to-day life and people like us and the media and everything. So it was kind of a great conversation, Doctor. And I would really look forward to more of these.
Look forward to next
thank
conversation.
you so much for your time. I thoroughly enjoyed it.
Thank
It's
you
very
for-
informative.
Thank you for being here.
Thank you.